So our approach to partnership again goes to increasing access to care and also improving the quality of pediatric care in the East African region. So, and we have very many partnerships, and we've had very good success in terms of outcomes and impact as far as partnerships are concerned. So I gave you the example of the partnership with the World Diabetes Foundation, the University of Nairobi, and the Aga Khan University Hospital. That's a very good example of a PPP, because the University of Nairobi is actually a public entity, and through that partnership we've been able to train almost 70 pediatric fellows in the region. And the way the partnership, the training is modeled is that once you get trained, you go to your country and set up a pediatric endocrinology care program. And actually out of that program, a similar program was set up in Nigeria to train pediatricians in the western part of Nigeria. So that's one very critical one. The other public-private partnership we have with the government is training subspecialty nurses. So we've trained in the last few years close to 400 nurses in pediatric subspecialization, meaning pediatric nursing and pediatric critical care nursing. Believe you me, the majority of those nurses are public health nurses. They work actually in the public sector. So the training is such that then they'll go back to their counties and help set up critical care, especially the critical care services for the county hospitals. The other partnership that we've done very well is with the Smile Train International. So every week we do almost 5 free cleft lip and palate surgeries. So the children come from wherever in the country and they come here. It's 100% free to the children, but then it's done in partnership with the Smile Train International. So I think in the East African region we do the highest number of cleft lip surgeries for children. The other partnership we are very proud of is HIV care. So we established a free HIV treatment program for children in 2003. And it's endured all this time to date. The kids we are tending to those days are actually parents now themselves. Yes, the first children that we attended to, and we've been able to meet very high outcomes. This is done in partnership with the government. It's done in partnership with USAID, Global Fund, and many other partners. So our latest partnership you alluded to is on telemedicine. So we realized that there aren't enough subspecialists, pediatric subspecialists in the country. And so you have children in many corners of this country who are referred to a pediatric subspecialist, or even up to a pediatrician, and they can't get access to a pediatrician. So what we did was to work with our ICT team and with our clinical team to set up a telemedicine program. And so through a lot of research, you're able to get equipment that improves the actual interaction between the clinician, who is almost 300-400 kilometers away, with the patient who's in a remote corner. So it's not, when people hear telemedicine, they think it's a video chatting process. It's actually more complicated than that. It has stethoscopes, it has what you call dermal cameras, it has ECG equipment, it has ultrasound equipment, which the clinician sitting here can actually apply on a patient who is whichever distance away. So we did this first with Garissa County, and about 4 years ago, which was what we call a test of concept. And once we figured out it is very successful, then now we are in a scale-up process. So we're currently working with the Safaricom Foundation and the M-Pesa Foundation and Gertrude's Hospital Foundation, and now the Gertrude's Children's Hospital, to provide the service. So the hospital actually provides the service, meaning there are clinicians, and there's a referral process in the counties through which patients are booked. Since there's referral, the patient must be seen first by a clinical officer or a medical officer. And then those that require referral then are booked for the pediatrician sitting here to attend to them remotely.